Welcome everybody to another special edition of the Board of Trade in New Hamburg podcast. We're joined today by Dr. Laurie Sellers, who is on the hospital staff at both hospitals in Kitchener-Waterloo, so Grand River and St. Mary's General Hospital. And my co-host today, as always, is Gina Rattan.
Good day, everybody. Excited to have Dr. Sellers here today. I think we're going to chat a little bit today about the vaccines and the rollout in our region. So thank you so much for coming on to talk to us today, Dr. Sellers.
You're welcome. Happy to be here and spread the good news about the vaccine.
That's right. It is some good news stories. I think probably all of us know a family member in healthcare or possibly a parent or grandparent that's in long-term care that's got the vaccine already. So that's fantastic. It's started to roll out. So jumping right in here with Dr. Laurie. The vaccines are on the horizon for the majority of people in the near future. How do you anticipate the rollout going for people in our own community? And what do you hope happens here in the region?
Well, I certainly hope that there's a local clinic right in New Hamburg that gives people the opportunity to obtain it right in their own community. I think the lineups would be great, be easier to control and to manage. But these clinics are really quite complicated, from lining people up, social distancing outside, which everyone's pretty used to now, but getting inside, registering, having enough iPads to register people. They ask questions like, is it okay if we email your vaccine documentation to you? So a lot of privacy questions are asked and gone over. It all takes time. Then probably what happens is people move on to the nurse or the immunizer. They may, we're not certain who exactly will be immunizing, but they'll have some sort of training. And to be honest, it's not that hard to give an intramuscular injection. So they'll have those questions. And those are things like, are you allergic to PEG? And why would you ask that? PEG is in some cosmetics. It's also in some laxatives. People might have used it for a bowel prep, for a colonoscopy or something. And some people are allergic to it. It's in the vaccine to stabilize the fragile genetic material. So that it could be an allergy. I believe the most recent that I read was the stats are 1 in 11 million people will have a severe reaction to it. If we can screen those people by history of reaction, I would think that they would go to a clinic that might be closer to an emergency room. Maybe the one at Grand River Hospital would be a good place for them to go. But I'm not sure what that would look like. It hasn't been disclosed. I have no special knowledge other than I have worked at the clinic at Grand River Hospital as a physician. And we did have a reaction or two, and a couple people went off to emerge. So they weren't life-threatening reactions. They were just not recovering. One person was very sick after getting the immunization, more a fainting episode. So that had to be monitored for an hour or two after, beyond what we can do in the clinic. So we could have kept her, but it takes up staff time. An immunizer had to be with the patient. So that's better done in an emergency room where they're not disrupting the flow, which is really important in this vaccine clinic, is getting people through. Then after you've had your shot, which for me, actually the last time didn't hurt, so that's good. They wait for 15 minutes and then there's a checkout and you get a ticker tape of documenting that you received the vaccine. Or maybe that will all change in the community. Maybe it'll just be totally electronic and no pieces of paper. So it's hard to know exactly what the vaccine rollout will be like, but I'm sure it's going to need military organization to get everyone organized. And I guess that's what they're trying to do. Yeah, the vaccine will come. It will come.
Yeah, it's a huge supply chain issue at this point, and
I'll say
creating billions of doses, and you need it twice or not in some cases, with the new developments from different companies and things like that. But
yeah, and the different refrigeration requirements that also pose the challenges.
True.
Sure. And I guess I know we have a couple of different vaccines. Only 2, I believe, have been approved so far at the date of recording here in Canada. And both of those are mRNA vaccines.
Right.
So can you kind of explain to us a little bit what that vaccine is and, you know, why it's beneficial or why we've approved these kind of vaccines for use in Canada when, you know, they haven't necessarily been around for that long in our knowledge, right?
Right. So mRNA is just a piece of genetic code that the cell can manufacture and release out into the rest of the body. So the mRNA, the messenger RNA, is the code for the one that's in the vaccine is the code to make part of the spike protein. So the spike protein is what your body would react to. So the mRNA is injected into your muscle cell. Your muscle cell makes the spike protein antigen for your body to react to. So it doesn't make the full coronavirus, it just makes part of the spike protein. So your body can build antibodies to this protein that it now has seen before. So when your body sees the spike protein again, it will know what to do. It has an immune memory on the immune globulin cell. So that's how it works. It's fairly simple technology, but yet mRNA technology is really quite complicated. mRNA is very fragile. So what they've done is they've wrapped the messenger RNA in a small bit of cholesterol using nanotechnology. So think kilometer, think millimeter, think micrometer, think nanometer, and it's a nanotechnology. So it's very tiny and very fragile. So there are some other things to stabilize the vaccine. The vaccine has very few ingredients. It's quite pure. It has PEG in it, as we mentioned, which some people are allergic to. So that's really the only major contraindication to getting the vaccine is if you're truly allergic to PEG. Those people can't have this vaccine, but there'll be another vaccine that they can choose from.
But mRNA vaccines have been used before.
Oh, that's right. They've been around for 30 years. They're developing in cancer therapy to target cancer cells. So it's been around for 30 years. And apparently Moderna had the code and the vaccine made last January of 2020. So they had it very quickly made. All they needed to do is run it through the approvals. Usually when vaccines or drugs are getting approved, there's a lot of funding and a lot of conferences in between and things that the scientists do besides focus completely on making that particular drug or vaccine. So with this vaccine, all the focus was on making it. There were no conferences, there were no coffee breaks, they worked a lot of hours. There were no water cooler conversations other than around the mRNA. Then when they rapidly went from phase 1, 2, and 3 trials, the funding was right there. They didn't have to write grants. I have a couple of friends that work in the research industry within medicine, and I know when it's grant time, you never see them, their wives don't see them. So these grants were already available, the funding was available, so we could very quickly go through the phase 1, 2, and 3 trials. And in fact, the phase 3 trial is still ongoing. It will go for about 2 years and maybe even longer after the vaccine was approved. The vaccine has an interim approval, so it was not fully approved, but it is an interim approval, and there's no reason that in giving out the vaccine that the scientists have seen to remove that interim approval. So it's certainly being watched.
Oh, and we've had people vaccinated for a fair few months now, right, to watch their reactions. So it's not like we have no data at all, right?
Right. So a fair number of pregnant women have had the vaccine, 10,000 in the States, and we've done them at immunized pregnant women that have wanted to be immunized at Grand River Hospital. And there's a registry out of the University of Washington, obstetrics and gynecology department that has a registry for pregnant women.
So they're certainly able to monitor those pregnancy cases, and I know that it's a big concern for a lot of women, obviously. And this morning, as I was talking in the office with a colleague about the vaccine, his wife is pregnant and is not sure if she's going to get it or not. So I'll definitely share that information with him and his spouse so that they can make a better informed decision?
It depends on the circumstance. If you can stay at home and stay away, there's no reason to have it in pregnancy. But if you're a frontline healthcare worker, a grocery worker, you'll want to have that vaccine for the safety,
Right.
I would think.
Yeah, maybe she's not eligible or on the list like me.
You'll get yours. Your vaccine will come.
Yeah, I'm sure it will, but somehow I don't think that, I'm right at the top of the list.
That's true.
And I'm okay with that. Yeah, let's
Yeah.
protect everyone that's out on the front lines interacting with the public well before me.
Absolutely.
You've done an amazing job of staying home and staying away from people.
Yeah.
Yeah, that's to be appreciated. Thanks.
So as we talk about crowds and sort of that being a part of the way to prevent the spread and the logistical confusion about how to accurately and safely roll out the vaccine and prevent the crowding from happening, we talked a lot about it at the beginning of the pandemic as herd immunity.
Mm-hmm.
What is herd immunity?
So herd immunity, to my understanding, is when the illness does not spread within the community because so many people are immune. And they're using the magical number of 70% of people would be immune. But I'm wondering, if it needs to be actually higher to really prevent a lot of spread. I'm hoping there'll be good uptake with the vaccine and that the wild virus stops mutating because it's not being reproduced in the wild so much. That's the big risk, is if we don't immunize other countries, the virus will mutate into some kind of different kind of coronavirus. And that's what coronaviruses do, they mutate. And it will really rapidly require a different vaccine. And then to go through all this again would be very disheartening. Having said that, if they do need to update the messenger RNA vaccine, it can be done quite nimbly and effectively. So it's kind of like the flu shot, gets updated every year. But just running through my imagination of having to immunize, so many Canadians every year for coronavirus will be really, really a mammoth task.
So what I'm hearing is that, because I know in my mind, at least, when I think of herd immunity, I'm only concerned about Canada and my immediate surroundings. But it sounds like herd immunity really needs to be thought of at a global scale in order to return to this normal life that we talk about, right?
Yeah, and that's kind of the elephant in the room where we don't really realize exactly, yes, it's wonderful to have Canadians immunized and won't it be great to have our neighbors immunized, but when we think of, we actually need to reach out to other places in the world so that the virus doesn't mutate so much and so that others are protected too.
Absolutely. So herd immunity is definitely incredibly vital for us to return to some semblance of a normal life, pre-pandemic life anyway.
And I think you're right that it's some semblance of normal. Maybe I'm pessimistic about thinking that we won't really get back to normal. Social distancing will probably be around for a long time. You'll see people wearing masks, choosing to wear masks even after the vaccine has been doled out. I think that's probably going to be a new normal and acceptable practice. Hand hygiene. I remember going to Ricky's kindergarten class and washing hands and plating the hands and showing the bacteria that grew before and after washing hands. And the kids were really quite excited about seeing how few bacteria grew on the agar plate compared to before they washed their hands. So start them young.
No kidding. Yeah, I hope hand hygiene definitely sticks around. I think that's a good one to have stick around for a while.
And, I'm going to put a plug in for mask hygiene. We need to think of a mask as a dirty Kleenex. So it's been on your nose. It's like those hankies that used to be around a long time ago where men would use the hanky and shove it back in their pocket. That's totally gone by the wayside. It's awful to think about it. But the mask is pretty much the same. It's a dirty hanky. It needs to be washed every time you use it or disposed of. Some people are drying their medical masks and using them again, and that seems to be acceptable. We're even encouraged to do that in the hospital. But once the mask gets wet, especially in the winter, it loses its protection for you and other people.
An excellent point to make, especially while we're, all waiting for this vaccine rollout. We need to make sure we're still doing everything we can to protect ourselves and others.
So here with me that I've got is a surgical disposable mask. Sometimes I also have a cloth mask. Are there any differences in how effective those masks can be?
There is. They say triple layered cloth mask or a cloth mask with 2 layers and a filter that you change is really getting to be as effective as a medical mask. It depends how you treat the mask too, right? So when I take a mask off, if I'm going to reuse it, I grab it by the ear loops and then I put it into a Tupperware container and leave it open to dry and the ear loops out the side. Once it's dry, then I can seal it up or I put it in a plastic bag. And that's one thing that I wish that those that do the announcements for the government would do, instead of folding it up nicely and then setting it on the podium and the next person comes up and folds it and puts it on the podium. I think a nice container would be good. It gives a great use for those old plastic containers. Even a margarine container that's washed and cleaned frequently is a great receptacle for your mask.
Yeah, sometimes I have watched those political announcements and kind of cringe as they take the mask off with their hand and then are holding it and folding it and playing with it in their hands. And it's like, yeah, mask hygiene is something that I have not heard much about in the media. It's focused on hand hygiene, but mask hygiene, is equally important.
Yeah.
That's funny.
Yeah.
Everyone's gonna be
I think we're all
keeping their
gonna
margarine.
Looking for the margarine containers, and I'm gonna be watching those posts more, or when they go up to the podium to talk. I'm gonna be watching them with their masks now.
That's right.
Well, at least they're wearing them now most of the time for those posts.
That's right. That's right.
Very true. Okay, so I guess maybe getting just back a little bit on the vaccine. I know there's a lot of myths that are going on about the vaccine, and they're all over social media. What do you think is most important for people to know? What myths really irritate you?
I haven't read a lot of myths because that's not what I read about. I read about the truth from reliable sites. So that has stumped me. But one of the things to know is that the side effects of the vaccine that we all know are like fever, aches and pains, nausea, like coronavirus symptoms, and they'll probably happen the next day after your vaccine. And actually in the medical community, when someone gets a good response like that, a lot of illness, sickness, we all kind of celebrate and say, hey, you got a great immune response. And that's wonderful. If you get a lot of side effects from the vaccine within the first 1 to 3 days, that's really a great immune response from your body. Tough to live through, but it's a really good immune response. And so I think you need to think of that as, I didn't get coronavirus from the vaccine, but I did get a big immune response. And I think that's probably the biggest something to know before you go into the vaccine, because some people do feel really crappy the next day. And it seems that younger people feel a lot worse than older people. But having said that, they say that older people mount an immune response quite nicely to this messenger RNA technology.
Yeah, you had gotten your first shot, and I don't think you had much of an immune response. But then after the second one, you did have those symptoms for a day.
I was down and out for a day.
Yeah. So congratulations on your excellent immune response.
Celebrated it.
That's
and
great.
I guess I know another myth I've heard a lot is, the vaccine will change your DNA, but I think we've kind of gone over that mRNA is very different and it does not change anything. It just produces antibodies in your body to fight coronavirus. Right.
It makes your muscle cell make some antigen, some coronavirus-like parts of the spike protein, and then you make the antibodies in response to that. So that's
your,
right.
Your hair color is not going to change because your DNA got changed then.
No, that's coming up soon. That's true.
Yeah.
And I know one other big concern about people is that the vaccine was rushed and that it's gone to market way too quickly. And I know we did also chat about that a little bit.
Yeah, that's true. That it missed no steps. It didn't miss any steps. It's still under surveillance. And there've been really no red flags in the millions of doses that have been given around the world. So that's very exciting.
Very encouraging. Very.
And what's more exciting too is that Canada will revamp its vaccine making technologies, which would be really, really wonderful to have some vaccine making companies. We have Sanofi, which makes the vaccines for the children and your tetanus shots and things like that. That used to be called Canot. And if anyone remembers the old Canot insulin and the polio vaccine that came around in the 50s that was made by Canada, and ours was actually superior to the one in the United States, the polio vaccine. So we do have a big, long vaccine history, and it will be really nice to revamp that in our own country.
Yeah,
absolutely.
There's a company from Calgary that is seeking a vaccine approval right now.
That's exciting.
Yeah.
Yeah. I think this has shown us how important it is to have our own capabilities on our own soil.
Yeah, that's right.
Yeah. And finally, why do you think it's so important for everybody to get the vaccine?
The virus, when it reproduces in the wild, mutates into things that we've never seen before. And that's what coronaviruses do. They mutate and they change themselves to disguise themselves to our immunity. And that's a very dangerous thing if we want to really get back to any kind of semblance of normal. So that's important that we nip this in the bud with the vaccine and with getting immunity, and most people would be immune and not spreading it. The other thing too is we're starting to see some long-term effects of having coronavirus at all ages. And when we think of MS being, something, multiple sclerosis, it's thought to be related to some viral infection that you had years ago. And the coronavirus could do the same thing to our nervous system. It could attack the myelin, which is the insulating lining on the nerves. It could do something to the central nervous system inside the head, inside the brain. It can leave long-term fatigue. It can leave long-lasting tail-end effects that can be really devastating to all ages. But imagine each day facing, pain, not making your muscles work, a foggy brain, as you enter your 20s. That would be a horrible, horrible sentence. So I think it's really important to nip this before it spreads too far.
That's interesting about the long-term effects. That's something that I did not know about. So thanks for pointing that out as yet another reason to the vaccine and take this seriously.
Yeah, it's very serious.
Great. Do you have any other questions for Dr. Sellers, Gina?
No, I think you've answered everything, and I really appreciate all the insight you've given us. I mean, I follow a lot of COVID news and everything like that, but there's a lot of things that you mentioned that have definitely resonated with me and new things that I've learned. So I really appreciate you taking the time to talk to us and explain about the vaccine.
Super. So don't touch your mask, wash your hands, and stay safe.
Oh, what percent of alcohol should the hand sanitizer be?
70% ethanol.
Okay.
Yeah.
I think that's pretty well been the standard, but
yeah, that's a good question.
I have seen older bottles that are 60%. But
interesting.
Better than nothing, but
yeah,
when you're buying now. And there's a lot of nice Canadian made hand sanitizers that give us a lot of options in terms of sizes and odors and lack of odor and that kind of thing.
And potency.
Yes.
Yeah.
Some of the ones that I saw coming out of distilleries are 80 or 90%, I think. Not
they
necessarily.
Smell it.
Yeah.
Yeah.
Yeah. Thanks so much, Dr. Sellers. And
Good. Thanks for having me.
yeah, have a good rest of your day. And
Yeah,
thanks
thanks.
everybody for watching our
Thanks.
special COVID-19 podcast.
Great. Thanks, everybody.